Medical Director of Metropolis Pain Medicine, Dr. Devi Nampiaparampil joins me now. Dr. Devi, how transformative will this move be for our health, our nation's health, and the health of those that are in these communities where they're using SNAP and, quite frankly, junk food is just too available to them?
I agree. I mean, I think it's good that we should do different things to steer people away from these junk food options and from candy, because what you really want is to increase access to healthier options. I mean, so I'm in favor of the move. I like the fact that we are looking at health as a more expansive sort of situation across agencies. But I do think, the focus isn't solely on restricting foods, but also expanding access. So if we're going to do SNAP, to make sure that people do have the ability to afford enough healthy options.
That's such an important point, because you need to make sure that these food deserts, where it's tough to get fresh foods, fresh vegetables and the like, you need to make sure that they have that option to then use their SNAP money and other monies on that. Is it possible, though, to undo decades upon decades of the damage that junk food has caused to basically all of our bodies?
Well, that's a real philosophical question. I mean, that's the hope in medicine, right? Because we get exposed to so many things, whether it's junk food or other environmental toxins. It's really going to be a process between prevention and then treatment also, as we figure out more of the connections, as you said, for heart disease, for cancer, all of these things that can cause this chronic inflammation in the body.
Meantime, a new report has an absolutely alarming warning about plastic. The Lancet Medical Journal saying plastics cause disease and death from infancy to old age and are responsible for health-related economic losses exceeding $1.5 trillion. Some of the effects of plastics include, or having too much of them in our bodies, strokes, diminished cognitive function, cancer in adults, obesity in children, type 2 diabetes, and cardiovascular disease. Dr. Devi, I'm not joking. My wife and I have at least one conversation per day about our kids' plastic exposure, what we can do to limit it. But as you know, plastics are everywhere. So what do we do, Dr. Devi?
Yeah, so it's tricky because here too, we have to separate the plastics from the chemicals that are added to it. So you have bisphenols and you have phthalates, and it is everywhere. There isn't in medicine a good test to be able to check to see if people are exposed to quite a bit of plastic and exactly what harm that's doing. But as you said, because plastics are everywhere, there are studies showing that microplastics, the breakdown products, are often in the gut, the lungs, sometimes the brains of people. We do have to have some caution, but some simple things, of course, if you can substitute plastic cartons for glass, that would be better, especially if you're heating things, because that's when you tend to form these breakdown products. Sometimes, it's really hard to know when you're exposed to plastic, because it can be in cosmetics, these plastic beads, it can be in different types of clothes that when you put them in the washer, then you get the breakdown products. I would say kids' toys, a lot of these chemicals are added to different types of plastics, which is why we have different properties in plastic. Some are hard, some are soft, some are easier to clean than others. But really separating out what could be, at least in terms of the future of health and medicine, we have to separate out what's coming from plastic itself and from the additives.
I buy so much gosh darn steel these days. Amazon probably thinks I'm building a ship or something, because it's crazy how much steel I buy in lieu of plastic. Dr. Devi, thank you for your time. We appreciate it. All right, from